Dr. Julie Fietta. Today is the second installment of our series on Complementary Integrative Rehabilitation Medicine, or CIRM. We're doing this because I, along with my colleagues at the American Congress of Rehabilitation Medicine's CIRM group, realized that not a lot of people know what CIRM is. So we're bringing in a number of CIRM professionals to tell you what CIRM is to them and to help explain the different types of professions within this domain. Today we're going to be talking to Nabila Enam, a clinical associate professor at St. Joseph University in the Department of Occupational Therapy. Thank you for joining us, Nabila.
Thank you for having me.
Absolutely. Okay, so this series is designed to introduce viewers to CIRM, or Complementary Integrative Rehabilitation Medicine. Can you provide us with the definition of CIRM as you understand it?
So complementary integrative medicine is a holistic approach to rehabilitation where conventional rehab medicine and complementary medicine kind of blends. And under complementary medicine, there are various type of approaches like yoga, mindfulness meditation, Tai Chi, biofeedback. And somebody who is a complementary integrative medicine, rehab medicine, implementing that type of technique, they will look at not only the physical part, but also emphasize on the mind-body connections. And treatment will be much more client-centered. So let's say if somebody comes to with the back pain, chronic back pain. So individual who's practicing CIRM, not only going to look at the area of the back where it's hurting, but they also going to look at their habits, how their posture is, their stress level, because those things can also impact somebody's back pain issue. So in my opinion, it's a more holistic and whole, looking at the whole person when you're treating.
I appreciate that really holistic definition. Second question, can you tell us a little bit more about your work in CIRM? What do you do? What types of clients or patients do you work with? And in what ways are you working to impact their health?
So I want to go a little bit back in time because I want to share like how I came into CIRM. So my journey in CIRM really started as a clinician when I was working in the clinic as an occupational therapist. I was working with brain injury population and I was treating individuals who are many years post. And I started seeing that conventional approach to treating their balance and spasticity wasn't so effective. And that's when I started reading that some OT and PT were using yoga as a approach for helping with balance with Parkinson individual, MS population. And I decided, why can't we use the same approach with brain injury population? So I went for my teacher training in yoga. I completed 200 hours. And I started doing yoga in my practice, but I used my OT lenses and my yoga training to create like chair yoga, gentle yoga. So it was modified to fit the need of that population. So that's where my passion and interest came into. 10 years ago, I transitioned into academia. So my focus now is more in the research because even though I think complementary medicine is becoming much more popular, but it's not truly understood. There is not a robust evidence to know why and how it works. So my research looks at using mindfulness yoga to, stress reduction, sleep improvement. And I also teach that to my students. I teach a weekly yoga class for students because it is also important that they learn how to take care of their health and wellness. As we know, higher education students has high level of anxiety, stress. So right now, my kind of interest and the path that I have taken in CIRM is more in education and research.
Okay, I promised you this would be brief, so I only have one more question. If someone is interested in either finding a CIRM-based clinician or getting more involved in CIRM approaches, what advice do you have for them? Where can we find practitioners that are trained in complementary integrative rehabilitation medicine approaches?
I can tell you specifically for yoga because there is so many different types of complementary approaches. So you really have to look at what what are you looking for, and you have to look into that area. I have more knowledge in the yoga area, so I can tell you that going to Yoga Alliance organization, where you can find register yoga teacher and also schools that provides training. And I suggest that because once somebody becomes trained in yoga, they register with the Yoga Alliance, and they have to maintain certain continuing education to keep their licensing. And also the school that trains individual, they also have to go through certain amount of process to get that privilege to train individual. So you would get the people who knows what they're doing. I would suggest that if you really just want to learn about CIRM, well, of course, getting into involve like taking classes, because there are different yoga classes. There's different approach to yoga. There is not like one type of yoga. You could also practice mindfulness meditation, their app, but also, you can join our SUM network group, which is part of American Congress of Medicine. And when I joined that group, I learned about even more different types of complementary medicine that I wasn't aware of. I got to collaborate individual on different projects, presentations, but also get to hear from really some pronounced people who are doing some great work in that area.
That's wonderful. Thank you so much for sharing what CIRM is, what your role in the field is, and how we can connect with the different CIRM practices. You talked specifically about yoga today, but as you mentioned, there's a lot out there. So thank you for watching. We'll be excited to introduce you to additional CIRM practitioners here in the coming months, so make sure you stay tuned.